Welcome to EduMatch Online University. We are opening Module 2, Anatomy, Physiology, and Vital Signs. I'm your instructor, Anita Johnson, and I will be guiding you through the foundational theory that underpins your practical certification. Our roadmap is straightforward. We start with foundational classroom theory, progress to patient care skills training, and finally bridge into hands-on clinical experience. The core objective of this specific module is to connect what happens inside the body with what you can measure on the outside. We are bridging the gap between internal structural biology and external clinical observations. Before we begin, it is critical to note that your clinical scope and practice are strictly governed by state and federal regulations. You must always follow the specific legal guidelines established in your jurisdiction. A certified nursing assistant operates as a legally mandated clinical observer. Your duty is to safeguard the patient's internal balance by recognizing what their body is trying to tell you. All human health and illness begins here, at the microscopic level. The cell is the basic fundamental unit of life, and every physical process relies on these individual units functioning and dividing correctly. We use two distinct frameworks to understand this process: anatomy, which is the physical structure of the body's parts, and physiology, which is the function of how those parts operate. Returning to the cell, we find a universal architecture. Regardless of its eventual role, nearly every cell contains a surrounding membrane, a nucleus, and the genetic instructions required to survive. Cells share functions to form tissues. We have four types: epithelial, covering surfaces; connective, binding structures; muscle, driving movement; and nerve tissue, conducting signals. Tissues form organs, like the heart, a muscular pump. Organs form body systems, like the cardiovascular network delivering blood. As a CNA, you will monitor several distinct networks, including the integumentary, nervous, endocrine, and gastrointestinal systems. It is also your responsibility to recognize how normal aging naturally alters the physiology of every single one of these systems. Understanding this biological hierarchy is essential. When a microscopic cellular failure occurs, it cascades upward, ultimately manifesting as a systemic physical symptom that you must detect. Those physical symptoms are what we measure as vital signs. They are precise, external indicators of the internal physiological systems we just built. We begin with the cardiovascular system. It acts as the body's primary delivery engine, circulating nutrients and oxygen while removing waste. A pulse is the physical expansion of arterial walls, echoing the heart's pumping. You count this expansion at specific sites, commonly the radial pulse at the wrist or apical pulse over the heart. Factors like age, exercise, or medication directly alter this rate. The pressure inside those arteries gives us a second critical metric: blood pressure. This is the physical force exerted against the arterial walls by the circulating blood. Blood pressure is measured in two phases. The systolic pressure records the active pumping phase of the heart, while the diastolic pressure measures the resting phase between beats. Capturing this data requires precise technique using two specific clinical tools: the stethoscope to listen to flow and the sphygmomanometer to measure pressure. You must also be prepared to take an orthostatic blood pressure reading, which tracks pressure changes when a patient stands up. Before taking any measurement, always check for contraindications, such as an IV line or injury that prohibit using a specific limb. Taking a pulse or a blood pressure reading is a direct, real-time mechanical assessment of the patient's cardiovascular engine. The cardiovascular system relies heavily on our next focus, the respiratory system. Its primary physiological function is critical gas exchange, bringing oxygen in and pushing carbon dioxide out. A healthy adult typically breathes at a rate of 12 to 20 respirations per minute. Internal factors like illness and external factors like room temperature or physical positioning can quickly alter this baseline. When taking a respiratory rate, you must count discreetly. If a resident knows their breathing is being watched, they will subconsciously alter their natural rhythm, resulting in inaccurate data. Beyond the raw count, you must observe the quality of the respiration. Look for abnormal breathing patterns, shallow intakes, or labored movements that indicate distress. The effectiveness of this gas exchange is measured by oxygen saturation. This metric tells us exactly how successfully the respiratory system is delivering oxygen into the bloodstream. We use non-invasive probes to measure these oxygen levels. However, you must be aware that poor circulation, cold extremities, or even dark nail polish can skew the sensor, yielding a false reading. By monitoring respirations and oxygen saturation, you provide the healthcare team with a non-invasive, immediate window into the patient's lung function and systemic airway health. All of these systems work toward a single goal: homeostasis. This is the body's constant internal effort to maintain a stable, balanced environment despite external changes. Core body temperature is the most immediate, universal indicator of a body's metabolic state and its homeostatic success. Temperature is not a static number. Environmental conditions, the time of day, and biological factors like age cause natural, predictable variations in their baseline heat. When assessing this metric, you will use legally and clinically approved anatomical sites. This diagram highlights the standard locations: oral, tympanic at the ear, and rectal. Because baseline temperature varies slightly depending on the location, you must use specific types of thermometers that are strictly calibrated for each respective measurement site. A sudden fever or an abnormal drop in temperature is rarely an isolated event. It is often the very first macro-level warning sign of a microscopic, cellular-level infection. Capturing these vital signs is only the first half of your duty. Accurate documentation is the critical second half. Think of the patient's medical chart as a clinical dashboard. As you input raw vital sign data, it generates a real-time status report relied upon by the entire interdisciplinary healthcare team. You bear a strict legal responsibility to accurately record these metrics. This means writing down the exact numbers and using the appropriate medical units of measurement for every reading. If you observe any abnormal findings or deviations from the resident's established baseline data, you must record it and immediately report it to the licensed nurse on duty. Precise data collection is the foundation of patient safety, maintaining resident dignity, and ensuring timely medical intervention. You have completed the conceptual overview of the body's internal architecture and the metrics used to monitor its functions. Take this theoretical knowledge forward into our upcoming modules, where we will focus on translating these principles into personal care and practical clinical skills. Mastering these fundamentals positions a nursing assistant as an essential clinical observer on the front lines of healthcare.